Addiction is a battle that millions of people face every day. It's a battle that affects not just the person struggling, but their loved ones, friends, and communities. Whether it's a dependency on substances like alcohol or drugs, or behaviors like gambling or technology, addiction takes over your life in ways that are difficult to break free from. But here's the truth. Addiction is a disorder, not a choice. And like any other illness, it can be treated. In this video, we'll guide you through understanding addiction, how to recognize it, and, most importantly, how to take steps toward recovery. Recovery is possible, and there is hope. Addiction is a chronic disorder that affects the brain's reward system. It creates a cycle of compulsive behavior or substance use despite harmful consequences. Addiction isn't a lack of willpower. It's a disease that alters how your brain functions, making it difficult to control cravings or quit on your own. Addiction rewires the brain's reward system, causing you to seek out the addictive substance or behavior because it releases dopamine, a chemical that makes you feel good. Over time, your brain craves that dopamine release, leading to dependency. What started as a temporary escape turns into a cycle of seeking that same reward over and over again. Substance addiction refers to alcohol, drugs, nicotine, or other substances that chemically alter your brain. Behavioral addiction includes activities like gambling, gaming, shopping, or even food addiction, where compulsive behavior becomes hard to control. Addiction often starts subtly, but over time it grows stronger. Recognizing the signs is critical in catching it early and taking steps toward recovery. Increased tolerance. You need more of the substance or behavior to get the same effect. Withdrawal symptoms. When you try to stop, you experience anxiety, irritability, cravings, or even physical pain. Neglecting responsibilities. Work, family, and personal responsibilities start to slip as the addiction takes priority. Loss of control. You want to stop but find that you can't, despite knowing the negative consequences. Isolation, pulling away from loved ones, hobbies, and activities that once brought joy. Admitting you have an addiction is the hardest and most courageous step. It's often filled with fear and uncertainty. But this is where your journey toward recovery begins. Recognizing the problem isn't a sign of weakness, it's a sign of strength. Admitting the problem opens the door to seeking help. Addiction thrives on denial and secrecy. The moment you acknowledge it, you take the power away from it and begin to reclaim control over your life. Speak to someone you trust. Whether it's a friend, family member, or professional, sharing your struggle is a crucial first step. Look into professional support. Consider speaking to a doctor, therapist, or addiction counselor who can provide guidance on treatment options. Know that help is available. Many people have walked the path to recovery and are willing to help you do the same. There are many different treatment options available to help you manage and overcome addiction. What works for one person may not work for another, so it's important to explore the different options and find what's right for you. For severe addictions, detox is often the first step. Detoxification is a medically supervised process that helps you safely withdraw from the substance while managing symptoms of withdrawal. Rehabilitation programs, whether inpatient or outpatient, offer structured environments for recovery with access to therapy, support groups, and medical care. Therapy is essential for dealing with the underlying causes of addiction. Cognitive behavioral therapy, or CBT, helps you identify triggers, cope with cravings, and change negative thought patterns. Therapy also addresses any co-occurring mental health disorders, such as depression or anxiety, that might be contributing to the addiction. Groups like Alcoholics Anonymous, or AA, and Narcotics Anonymous, or NA, provide a community of people who understand your struggles. They offer encouragement, accountability, and hope. These groups follow a 12-step model that promotes healing through shared experience and support. No one should have to face addiction alone. Building a support system is one of the most important parts of recovery. Your loved ones play a crucial role in your recovery. They provide emotional support, help keep you accountable, and can offer encouragement on difficult days. However, it's important for them to understand addiction as well, so they can avoid enabling behaviors and offer support in a healthy way. Loved ones should be supportive, not judgmental. Addiction is not a moral failing. Approach your loved one with empathy, not criticism. Set boundaries. While support is essential, enabling harmful behaviors will only prolong the addiction. Learn how to set healthy boundaries while being there for the person in recovery. Therapists and counselors. Ongoing therapy provides long-term tools to manage triggers, cravings, and relapse prevention. Peer support groups. Surrounding yourself with others who have been through similar experiences can offer encouragement and guidance during difficult moments. Once you're on the path to recovery, it's important to develop coping mechanisms that will help you manage stress and triggers without turning to addiction. Replacing addictive behaviors with positive habits is crucial for long-term recovery. Whether through exercise, hobbies, meditation, or creativity, finding healthy outlets for stress and emotion reduces the likelihood of relapse. Exercise regularly. Physical activity helps relieve stress, boosts mood, and promotes mental clarity. Practice mindfulness. Mindfulness meditation helps you stay present and manage emotional triggers without reacting impulsively. Pursue hobbies. Find activities that bring you joy and satisfaction. This can be anything from painting to hiking, writing, or volunteering. Relapse is not a failure. It's a part of many recovery journeys, but what matters most is how you handle it. By building a relapse prevention plan, you can prepare for difficult moments and prevent a full relapse. Relapse doesn't mean you've failed. It's often a sign that your coping mechanisms need to be adjusted or strengthened. Relapses happen when old triggers resurface or when you feel overwhelmed, but having a plan in place can help you get back on track quickly. Recovery doesn't end when the cravings stop. It's a lifelong process of growth, self-care, and commitment to staying sober. Identify your triggers. Common triggers include stress, certain environments or people associated with your addiction. Avoid or manage these triggers when possible. Have a support system in place. Make sure you have a list of people you can call when you feel like you might relapse. These could be friends, family members, or members of a support group. Create a relapse action plan. Know exactly what steps to take if you feel tempted. This might include going to a meeting, calling your sponsor, or engaging in a healthy distraction. Long-term recovery is about building a life that doesn't rely on addiction for comfort or escape. This involves making lifestyle changes that support your sobriety, such as surrounding yourself with positive influences, engaging in activities that bring fulfillment, and continuing therapy or group support. Continue therapy. Even if you feel stable in your recovery, ongoing therapy or counseling can help prevent relapse and address any unresolved issues. Stay connected to your support network, whether through regular meetings, staying in touch with your sponsor, or simply keeping close friends informed. Make sure you have a community that supports your sobriety. Celebrate progress. Acknowledge every milestone, no matter how small. Every day you stay sober is a victory. Addiction is a powerful force, but it doesn't have to define your life. Recovery is possible, and many people have gone on to live fulfilling, healthy lives free from addiction. It's a journey that takes time, patience, and effort, but you don't have to do it alone. Seek help, build your support system, and take it one day at a time. Each day is a step toward a brighter, healthier future.